Let's go to Roman from Pittsburgh. Roman, welcome.
Hey David, how are you?
Good, good. I have to ask, are you Ukrainian or Russian by chance?
It's funny. I moved to Cleveland, and there's a lot of Eastern Europeans around this part. I'm Italian.
Wow.
There's a sandwich. Yeah.
You know what's so
I
funny
found.
about I've never you would there's lots of people who are not familiar with the name Roman. And when you
Yeah,
tell them
it's
my
very
name is
rare.
Roman, they go, that must be because you're Italian. And I've never met anyone with that name who's actually Italian. They're always Russian or Ukrainian, but you actually are Italian and your name is Roman.
Yeah, ironically, it was my parents' favorite chapter in the Bible, but I just there's a sandwich shop around here that makes a Roman burger. So I
Hmm.
joke that they just were hungry when when my mom was pregnant. So
Fair enough. All right. Well, what's on
um
your mind today?
um I just wanted to comment. I'm an ultrasound tech or a sonographer, depending on how fancy you want to be.
Okay.
And, I have a lot of history scanning early pregnancies. So seeing all of these bills pass, it's very frustrating to see these people who obviously have no medical background trying to, you know, make any assessment on, Roe v. Wade or anything like that. It's very frustrating. Most of the people I do ultrasounds with have no idea that they're pregnant. So,
Yeah, and I
yeah.
think this is interesting. There's two sides to this, right? One side of it is you often will have a panel of like 8 70-year-old men saying we decide what's legal and abortion and all this,
Right.
OB care and all this different stuff. That makes absolutely no sense. Also, I think sometimes when we take this too far, we get into the stuff where, like, during the Iraq war, you had a lot of right wingers going, if you haven't been in the military, you can't have an opinion
Yeah,
about this war. And it's like, no, you
sure.
can actually. Actually, you can. So I
Yeah.
think we want to balance both sides of this, but
Yeah,
your
that's
point
fair.
is very well taken.
Yeah. It's just one of those things where um the medicine is like really messy, and like I think like even Joe Rogan, when he talks about it, he's like, oh, I'm pro-life, or sorry, pro-choice, but he's like, it kind of gets really messy when you talk about like late-term abortions, and I think that people really get mired in those details,
Yeah.
and like 80% of abortions occur like less before 12 weeks.
Yeah.
um like a quarter of pregnancies end before people even realize that they're pregnant.
Yep.
So I feel like there's a lot of misunderstanding of when abortions happen and like why they happen. Like just look. I mean, I'm not going to tell people to look up some of these complex medical things, but like hydrocephalus, like it's not a viable thing. Like I don't think that it makes sense to make someone carry a baby that doesn't have a brain to full
Yeah.
term. But I mean, what are you going to do?
One of the
Um,
other
uh,
things that's often
yeah,
mentioned in this discussion is the right wingers will say, it's crazy that you can walk in at 8.5 months pregnant and say abort. And when you actually talk to OBGYNs, they
right,
almost universally say number one, never happens. Once you're eight and a,
right,
if you're given a due date at 40 weeks and it's 2 weeks before that and you walk in and you go, I'd like to abort. First of all, OBGYN say it never happens. Number two, they almost exclusively say, I also wouldn't do it. At that point, you go, wait a second.
yeah,
There's no medical condition threatening your life? No. Well, so
yeah,
why would we do that? Let's talk about
yeah,
adoption. Let's OBGYN say that's an
yeah.
imaginary
Yeah.
situation.
Yeah. I mean, even at like 24 weeks, you can at least like, stabilize a pregnancy. But like before that, I mean, like it's not even a conversation.
Hey, real quick
But I
though,
had a,
I'm curious because so you're in a situation where you're doing the ultrasounds for women who they
mhm,
they may not even know they're pregnant. So why are they getting an
exactly.
ultrasound if they don't do what's the circumstance of them getting an
Uh,
ultrasound?
yeah. So, I mean, we do a lot of different ultrasounds. I'm what they call a general ultrasound tech. There are
Okay.
like other ultrasound techs who specialize in only doing OB.
Okay.
Personally, like the late term stuff it gets I feel bad a lot of times for those people who only work in MFM, because a lot of times they are scanning women who either have, they're at risk for some reason, because they're the most likely to come back
Yep.
for like follow-up scans. So that's maternal diabetes / obesity, drug use, twins makes you automatically at risk. Some sort of prior history of complication.
Sure.
For me, it's they come in through the ER and then they have some sort of indication, either pain, bleeding. Um, they came in with a positive pregnancy test and they had some sort of prior ultrasound and sometimes they come in to like get a follow-up. I don't recommend that coming in through the ER, especially if you're coming in from a different hospital system. We won't have that history.
Sure.
And it's very rare that this happens, but just want to put this out there. Do not come to try to get pictures if you're coming in through the ER. We can't let you take pictures of the screen. It's like a legal issue, and like we don't have a printer because we're not
Right.
designed to do OBs.
Now, because you're a tech, you're not delivering the news, oh, hey, you're pregnant, right? You're doing the scanning and
No.
then a doctor says, hey, this shows that you're pregnant.
Yeah. We write like a short little like they call it like a tech assessment.
Yep.
And then the radiologist can either agree or disagree with our assessment. I keep my mouth shut, and personally, I kind of like that. The liability is not something I want. And like I only needed, 2 years of schooling. The 10 years and $100,000 worth of debt just does not seem worth it.
I gotcha. All right. Well, listen, I appreciate you sharing about this. Super interesting.
Can I ask you a really quick question?
Yeah, go ahead.
Do you think it's good for Democrats if Ron DeSantis runs?
Too early to say. Depends who he's running against. I know the point of the question, which is like, is he a better or more difficult candidate to defeat? I just think we don't know until we know who the Democratic nominee is.
Yeah, I thought maybe if he ran against Trump, that it might cause like almost a split ticket, like a bull.
Oh, in the primary. That's another question. Yeah, it's just too early to say.
All right. Thank you very much.
All right. Thank you so much. Appreciate the call. Very, very interesting, I have to tell you.